Welcome back. Just tuning in, you're watching the Arthritis Show. Joining us exclusively in our studios today is Dr. Daniel Ramos. Welcome, Dr. Ramos.
Great to be here. I'm doing great.
I understand you have a PowerPoint presentation for us about arthritis and joint pain.
I'm going to be talking just a little bit about arthritis, how it affects the joints, and as a physical therapist, what we can do to assist patients with arthritis.
Perfect. So I'm going to start it from the computer here, and you could see the monitor up there.
Basically, with arthritis, we got to look at the joint. There's two types of arthritis. There's osteoarthritis and rheumatoid arthritis. But to get a better understanding of what happens in those joints, we have to take a look at the normal joint. The joint is composed of several different things. There's muscles, ligaments, tendons, and cartilage. And in both type of arthritises, the one that's most affected is the cartilage. Usually cartilage is a smooth, shiny, wet surface. It's almost like a glass gliding on glass. So it has very friction-free movement because of that cartilage. As we age and there's some arthritic changes in those joints, that cartilage will dry out, and instead of being glass on glass, now it's almost like sandpaper rubbing on sandpaper. So that's leading into the two types of arthritis. Starting with osteoarthritis. Osteoarthritis, it's characterized by symptoms that I tend to see in the clinic where patients will present with pain, stiffness, limited range of motion in the joints, whereas rheumatoid arthritis has similar presentation of symptoms with some differences. With rheumatoid arthritis, the patient may experience some warmth of the joint, tenderness, as well as swelling. Both types of arthritis are characterized by morning stiffness. With osteoarthritis, generally speaking, there will be morning stiffness lasting about 30 minutes in the morning. But as the patient gets going with their activities or the joints, quote unquote, warm up, they start to feel a little bit better. With rheumatoid arthritis, though, that morning stiffness will last about an hour. And anytime that the patient may be sedentary, that stiffness will come back and the joints can get inflamed, swollen, tender to the touch. And one thing, another caveat that makes rheumatoid arthritis different from osteoarthritis is the fact that with rheumatoid arthritis, it can affect both joints on both sides of the body. So if we're talking about an ankle, it'll affect them bilaterally or both sides of the body. Whereas with osteoarthritis, it'll affect one joint. It could affect several joints, but it won't be in that classical presentation of bilateral symptoms. Unfortunately, for both types of arthritis, there is no cure currently, but physical therapy is a great intervention that can really help patients deal with their impairments and their functional limitations.
Doctor, I just wanted to interject there.
Sure.
Between the rheumatoid arthritis and osteoarthritis, which one do you most commonly see?
Generally speaking, I tend to see osteoarthritis more. It tends to afflict more people just generally. Most patients will present with symptoms after the age of 45. And then it's about 75% of people over the age of 60 are afflicted with some sort of osteoarthritis.
I think that's essentially what we see here, mostly osteoarthritis, maybe 1 to 2% rheumatoid, and it just happens that osteoarthritis is very common. Just about everybody, you live long enough, you get it, essentially.
Pretty much. And before I get into how physical therapy helps, actually, since it is so common, things like age, like injuries or overuse. So even in younger people, we can get an accelerated arthritis from an injury, and a sports injury, whatever it may be. With as big of an epidemic as obesity has become, even obesity can contribute to the acceleration of osteoarthritis.
Oh, yes, absolutely. Obesity is a huge thing. We see a lot of people, especially female adults, when they get obesity, osteoarthritis in the knee is just like next thing that comes.
Yeah, and an interesting statistic that I've come across is that for every pound the patient is overweight, that's an extra 4 pounds of stress on the knee joint and up to 6 pounds of stress on the hip joint. So a patient can lose maybe 5, 10 pounds. That minimal amount can make a huge difference in their function and their quality of life.
Exactly. I apologize.
No, by all means. Well, let's talk about how physical therapy can help. Basically, our goals with physical therapy is we really want to try to reduce the patient's pain. We try to improve their range of motion, their flexibility, and improve function and prevent any further disability. We also are big on empowering patients, so they feel like they can take control, that if they have arthritis, it's not going to be that they have to live with it and it's something that they're going to have to manage, but they can empower themselves to be able to do something about it. How we go about this, there's several different things that we try to focus on. The cornerstones of our treatment is basically what the patients usually present with. So we try to focus on strength, on improving flexibility and range of motion. And that's basically the cornerstone of our treatment. We try to encourage patients to participate in the clinic as well as outside in low-impact exercises. So we try to get them to avoid any activities that involve running, jumping, heavy impact on the joints, and get them going active with aerobic conditioning exercises like the recumbent bicycle, the treadmill, the elliptical trainer. And then we try to address muscle weakness and muscle imbalances. So we can do that by incorporating dynamic exercises like closed chain activities. So for example, squatting, lunges, things of that nature, retraining the balance system so that those things improve, and improving flexibility and overall conditioning. And a lot of these patients, they can buy themselves some time before they have to succumb to something like a joint replacement or things of that nature. And later on down the road, when they're done with physical therapy, we encourage them to get on a home exercise program that we provide, as well as being advocates for our patients to get them in a community-based exercise program, participating in activities like Tai Chi, which has been shown to be very effective with osteoarthritis, and just get patients moving. A lot of people, like you were mentioning earlier with back pain, a lot of people just think they're they become sedentary and they succumb to their diagnosis. And no, we empower patients so that.
And really, that's one of the worst things that you could do if you have back pain. Just getting bed rest after bed. And studies have shown the longer you stay out, the more likely you would stay out.
Completely agree.
A lot of work.
And I provided here just so patients have some idea, resources they can go. The American Physical Therapy Association is a great resource. And I just provided there a couple resources that patients can rely on. With the internet having so much information, they can turn to reliable sources.
Exactly. Now, you have, let's take a moment and speak about your practice. You have a very unique practice. You work out of Aventura. Just for audience out there, let's put the name of his practice down there so they can contact him by themselves. Oh, that's the next exercise. Sorry.
Yeah.
So it's right here. Okay. So in Aventura, you're working with other physicians, but it's really you're on your own with other physical therapists.
Yes.
And there is orthopedic very close to you, and so how does that work for you?
It's great. I mean, obviously, with the practice of physical therapy, we can see patients who just come to us directly with direct access. That's part of how we manage the patients. But we also get referrals from physicians. So our practice is unique, is that we work very closely. We share office space with some physicians. And it's great, we're physical therapists, and the physician, we're in constant contact with each other, updating the physician on how the patient is and how they're progressing through the physical therapy experience. And we work closely to try to get the patient back to optimal functioning, and so they can get better quality of life.
Fantastic. So that's Dr. Daniel Ramos from selectphysicaltherapy.com. Thank you, Doc.
Appreciate it. Thank you so much.
Great to have you. Would love to have you back to you here again.
I'd love to be back.
Okay, let's go ahead and take a break. When we come back, we put a video about cell therapy that we're going to show that to you. Let's go for a break.